Welcome to the American Indian Alaska Native Behavioral Health webinar series presented by the National American Indian and Alaska Native Addiction Technology Transfer Center. I'm Kate Trams, and I'll be administering today's webinar. Today, we have invited Dr. Brent Learman to present on servant leadership, and we'll also be talking about the Leadership Academy program offered by our ATTC, and Mandy Conrad will be here to share about the program. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center. We are one of 4 national focus centers which serve the ATTC network. The network also includes 10 regional centers and a network coordinating office. To learn more about our center, the network or regional center, please visit our website. We've not yet confirmed our presentation for March 4th in this series, but please mark your calendars and watch for our announcement to come out shortly. We also offer the Essential Substance Abuse Skills webinar series each month. The next session in this series will be held on February 18th when Matt Ignacio will present group counseling. For more information on our webinar series, you can contact me at the email address or phone number provided on this slide. Our center is a NADAC certified educational provider, and we'd be happy to provide you with CEHs for a $15 fee. The CEH request form is available for download in the Files pod in the webinar screen. I will also be sending this form in a follow-up email to all who attended. Immediately following today's webinar, you'll be redirected to our GPRA evaluation. GPRA stands for Government Performance and Results Act, and SAMHSA asks us to evaluate our events in order to comply with this act and provide improved performance assessment and accountability. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. We thank you in advance for helping us to improve our programs. Before we start today's session, I'd like to go over a few instructions for the Adobe Connect system. To view the presentation in full screen mode, click on the full screen button at the top right corner of the presentation pod, which looks like 4 arrows pointing outward. To return to the regular view, click the button again. You will be muted for the duration of this webinar, so please use the Q&A pod to share your questions and comments, and we will address questions at appropriate points during the presentation. We would also like you to be aware that this webinar records participant attention time. And if you are planning on earning CEHs, you would want to know that if you minimize the webinar or are working in another window, the system will record your participation as inactive, which may be reflected in the number of CEHs received. The opinions expressed in this presentation are those of the presenter and do not necessarily reflect the official position of CSAT, SAMHSA, or the U.S. Department of Health and Human Services. So today we have welcomed Brent Learman. Brent has extensive experience in management and leadership positions, including having worked as the regional director for the federal government and as a human resources and leadership trainer and consultant in the private sector. He has authored many workforce development programs and has received many honors, including being recognized by President Reagan's cabinet as one of the nation's best trainers. He has served as a trainer for the Leadership Academy for the current year, and we wanted to welcome him to share on servant leadership today. Thank you so much, Brent, and I will pass things over to you at this time.
Well, thank you, Kate. Good morning, all. Never Land out there, and hopefully you're sitting in a nice chair and drinking a wonderful beverage, and hopefully this will be entertaining to you and delightful and potentially a learning environment. I have to start off, though, with a little story, and I'm of Cherokee descent, the Eastern Band, and we always are great storytellers, and I'd like to share one to kind of brighten your day, so to speak. And I had this unusual situation happen to me before we talk about servant leader and leadership, and we all have those type days that you've heard the old saying, it isn't my day. Well, I live on a ranch very close in Idaho, very close to the Nevada border, very high altitude, and we run grazing goats. My son and I have a nice flock of them, and of course, like any animal, I'm very animal-based, and 2 or 3 of the goats are if you want to say pets, they'll answer by name, etc. Well, I was leaving one morning to go to the airport, and I have to drive through a small town, and so I drive a pickup. And unbeknownst to me, I'd left the tailgate of the pickup down, and I get in it. I'm in a hurry, and it's dark, of course. And I get out of the house, and we just go. And we've all done that. You're a little behind time. You try to catch up time. So I'm going down the road, and I go through this small rural town in Idaho, and only has maybe 3 street lights in the whole town. Very small. And they're proud of those 3, by the way. And I look in the rearview mirror, and in the back of my truck, it stands a goat. And she had jumped in there, and she, now about 10 miles from the ranch, she had rode with no fence around there, just in the back, happy as all get out, looking me in the rearview mirror. And her name happens to be Baby. So I thought, oh my gosh, what am I going to do? And so here's a goat in the back of my pickup. I'm on the way to the airport. So I had several choices. A, leave the goat in the small town. B, of course, go back. Or C, take the airport, and we all go to the place I needed to go, which actually is L.A. And I thought, I didn't know what to do here. So I caved in, called my son. He got in the truck, and he met me about halfway, and we put the goat in his truck and went back. So that should be a good story. That you never know what you'll find in the back of the pickup. So anyway, I hope you enjoyed that. Again, my name is Brent Lehrman, and today we're going to talk about servant leader. And my job has been a couple-fold, but one of which is I teach leadership and interpersonal skill, and I was asked today to give a short presentation on that. So I have a few slides, and we'll kind of go through those right now. And one of the things we have to ask ourselves is, what attributes does a servant leader have? And there's 2 questions I get asked about this all the time. Are they the same today as they were yesterday? And, and why not? And in human behavior, we like to think that we're at the top of our game every day, but we know that's not true, nor is it realistic. Each day, if you want to take a wavy line, we have good days and we have bad days. And so we want to be steady as we go. So the question is, are they the same today as they were yesterday? We would like to think in leadership, and we want to think that we're a leader all the time. And that's what prompted this. And why not? Because there are things that affect, such as a goat in the back of a pickup. You don't expect that, and could that affect your day? Well, of course it does. But we're not allowed, because any person you meet they don't care about the goat in the back of the pickup. All they care about is how they're treated by you. So keep that thought in mind as we go through these slides, and keep in mind that we are leaders 24/7, and perhaps you've maybe heard that. Our next slide shows us is typically, and again this is tribal based, is a leader leads first. You could, a million books out there. We've authored books. And a leader leads first. That's true. But a servant leader, the people come first. And our tribal people, a leader leads first, but a servant leader serves first. Now, that's kind of a difficult concept to grab a hold of on a webinar. But what we want, it's difficult to be a leader to serve. And you think of the people first, that we think of how we're affected. And oftentimes I'm asked, well, what if you have somebody that's annoying, or that you're trying to lead, or perhaps maybe not trying to lead, just being around, and they're a strong annoyance to you. It does not give us the right to treat that person back the way they treat us. We have to be nice, courteous, etc., etc. Is that difficult? Absolutely, that's difficult. And the point that we try to make in this concept, this philosophy, if you will, is it's more traditional philosophy. We have a great person that I've gotten to know over the past years, and he's Sean. He is of tribal descent, and we'll leave it at that for now. But he makes me think that, and it really fits, that we have to go back to a traditional, is that we cannot allow one person to disrupt us. And before I go on, let me share another little story. Let's say, for example, we've perhaps seen bowling and perhaps we've done bowling. Let me give you an example. If you bowl the perfect game, and I'm certainly not a bowler, but you feel really good, or maybe shoot pool, and you do a really good shot, makes you feel good, doesn't it? Well, when you walk away from that game, whatever it is, could even be something at home, when you're victorious in that, it makes you feel that intrinsic value, makes you feel really good. That is awesome, because when you leave that game environment, you walk out, and that goodness, if you will, follows you. Now, the same problem that we face, if you face somebody that is an annoyance to you, and you start to feel bad, then that is just the opposite of the good game it makes you, and you carry that forward. And the thing we can't do is do that, because it does affect us. Now, going back to leadership, the next slide is some of the attributes, qualities of a servant leader. And you can see those as well as I, trustworthy. And those are almost like a slam dunk thing. Everybody realizes, sees those, dependable, credible, absolute. But what happens is it's an easy to list a list, but rather more difficult to live that list. And so, which leads us to the next slide, is, if I may ask, that if you have a piece of paper handy at your workstation or where you're at, or just, if nothing else, and we'll go through these, is that I want you to answer these, not verbally so much, but in your mind, or write them down. Is a servant leader always a paid position? So write yes or no, and we'll come back to these in just a minute. Is your personal time their time, be it employee, inside, outside worker, your family perhaps? Answer yes or no. Do your personal standards become their personal, such as your employees, your children, etc.? Yes or no again. Are the people in need important? Again, the people, all that I mentioned before, your employees, your coworkers, your family, etc. Are they important? Their needs? Answer yes or no. The next one, and we'll continue on here, we'll come back to these in just a minute, is an individual's personal growth. That's someone else, not yours. Yours is important too, don't get me wrong. But is it important? Yes or no? Is a person's well-being important? Someone, your family, your coworkers, your boss, your subordinates, whatever position you fit in, is there important? Yes or no? Does a servant leader try to move forward towards an act of goodness? In other words, you always try to do the right thing, that act of goodness. Yes or no? And the last question is, does a servant leader use the word I accomplished something? I did this. I got this done. Or should we be using, there are times that we use that singular word. What should we use? We are when we're describing successful work. we accomplished it. Yes or no to that? And what if you've done it and answered those, and I hope you have, let's go back. And the point of this little exercise is it brings us back to what's really important. Is a servant leader always a paid position? And what we would like, and the point of this is that do we always do acts of goodness that we expect or require payment for? And the correct answer we'd like to see, of course we have to have a paycheck. Of course we have to buy groceries. But the intent is we do a lot of things that is not paid for. It's just towards making people better. So the correct answer we'd like to see is predominantly yes here. Is your personal time their time? And you know, that's a hard thing because people come and bother us. We sometimes see it as a bother. They ask us questions. They want us to help. And it's very difficult to make our time their time. In other words, we're a sharing person. We share our time. So again, we would like to say, yes, our personal time does become their time to a certain degree. Does the personal standards become their standards? Now, I have a great example here. If someone sees us stealing or doing the wrong thing, and we continue to do that, such as a child, if we tell them not to watch TV, or we tell them not to do this, and then we do it, does that corrupt that standard? Well, it does, to a certain degree. So we would like to see our standards will, in fact, become their standards. So what I'm really saying here is you have to live good standards to be a servant leader. So the answer would be yes. People's needs is important. Absolutely, as we discussed, that their needs become our needs. We should show that empathetic, caring outlook. Okay? The next set of questions that we covered was an important personal growth. Is someone's personal growth important? Absolutely, because there's several reasons. For number one, it makes them feel great that we're interested in their growth. It makes them feel wanted. It makes them feel have significance, et cetera, et cetera. Plus, the benefit we'll reap we'll gain out of that is that they become more productive. They become better employees. They become better family members, et cetera, et cetera. So the answer would be yes. Is the people's well-being important? Absolutely. Because we got to show that empathetic, caring part of their well-being. We're concerned about their well-being. Absolutely. So the answer would be yes. Now, you'll certainly try to move towards an act of goodness. Absolutely. Is that difficult? Couldn't agree. Yes, it is difficult, but that does not mean that we should not try. So the answer would be yes. Does the servant leader use the word, I accomplished this, I got this done, I got this to this, I got this report done? Or should we say we got this done? We it gives credit to everybody. There was someone else there helping, and people gravitate towards a person that used we got this accomplished. So the correct answer also in this case would be we. So what we look at, and there's an exercise in the next, and we're going to postpone that. And this is what we want you would like to do, is I want you to read this and answer, and there's some questions to answer this, and we will be more than happy. You can contact Kate, and we will give you the answers to it. But idealistically, we want you to think about the servant leader, and this is applicable that can apply this short little presentation on leadership to this case study. With that, that's kind of my allotted time. Are there any questions for me? From anyone? Then I will return this back to Kate. Thank you for allowing me to share part of your day, part of your time. I hope you enjoyed it. And we're going to have time for some free goats when we're done. So you all have a good day. Thank you.
Thank you so much, Brent. And like you said, if there are any questions, please go ahead and submit them in the Q&A pod. If you have your presentation in full screen mode, you'll want to click that button again so you can see the Q&A pod. So submit your questions. The box to submit it is at the very bottom of that pod. So go ahead and type those in there, and we will respond to them appropriately as they come in. I just asked if they're automatically signed in. So if you register for the webinar and then you used the email address to sign in, then you will be tracked as having attended the webinar. I should mention sometimes people watch the webinar with more than one person in the same office. So if you did so and you wanted everyone wanted to receive CEHs, you should email me and let me know a list of who attended with you. And so I can update our attendance list. So looks like, yeah, that's the only question we have so far. We may actually have time at the end to go back and talk a little bit more about this exercise and the Servant Leader Challenge. So we'll go over, right now I'm going to invite Mandy Conrad to talk a little bit about the Leadership Academy program, and feel free to keep submitting questions throughout. And we'll address those as we go through. And so first I just want to say that Mandy Conrad is currently a PhD student in the Counseling Psychology program at the University of Iowa, and she's also working for us here in the National American Indian and Alaska Native ATTC. She is a research assistant working specifically on the Leadership Academy program. She has coordinated all of the events and is also a contributor to the update of the curriculum. So I wanted to have her talk for a few minutes on the program so you can find out some more about it.
Okay.
Thanks so much, Mandy.
Okay, thank you for inviting me. I'm very happy to be talking to you today about the Leadership Academy. Foremost, I want to give a little bit of background. The ATTC network did provide a Leadership Academy for approximately 8 years prior to this, but it was not culturally specific to American Indian and Alaska Natives. So we were approached just because people were kind of concerned about what behavioral health will look like in the future without the visibility of American Indian and Alaska Native leaders. And so what we've done is we've put together what we hope is a culturally adapted Leadership Academy based partly on previous material that we used and also an adaptation. We break it down into 4 phases, and so I'll talk to you a little bit about each phase. The first phase that we involve participants in is basically called an assessment phase. We use 2 types of assessments. One is called a 360-degree leadership practices inventory. And essentially what we do with that is we ask the participants to send that out to management and peers that they've worked with, and they get rated on various leadership skills. We also ask them to complete a strengths finder. And then we look at those results and we process that with mentors. And I'll talk to you a little bit about our mentorship model. So we want to have kind of an idea of who's entering our program, what might their skills be, what might their growth edges be, because a big piece of this is to help enhance, leadership skills. During this phase also, so this is prior to any face-to-face events, we also ask that each of the participants connect with their tribal community. We ask them to do it one of 3 ways, or even more than 3 ways. We ask them to either meet with a traditional leader within their community, an elder, or a medicine person. And we want them to connect with their community to kind of find out what's going on, what what type of leadership would work well in their community. And also, for those who aren't as connected to their community, we want to rebuild that connection because that's very important. So once this phase has been completed, we do get the results and we move into phase 2. Phase 2 is a face-to-face 5-day immersion training in which Brent led last time, and he'll continue to be the trainer for this event as long as he should stay on. And basically, we immerse them in a lot of different situations in which they get to test some of their leadership skills, and Brent provides some didactic information about how to enhance those leadership skills. During this time, too, we assess, what are their career goals? What are they hoping to achieve from this Leadership Academy? And then we pair them with an established mentor. And these mentors could come from anywhere in the country. And for instance, the mentors that we had, one was a psychiatrist and a professor from Portland. Another worked in substance abuse. So we really get a lot of different people who are interested in mentoring or being a mentee. During this time as well, the results are shared with the mentees. And they get to look over their strengths and look over their growth edges, and they develop an individualized plan with their mentor. And there are kind of 2 projects that they are considering during this period. One is an individual personal development plan to enhance their skills, and the other is a community engagement project. So in order to graduate from this program, which is a year long, the participants need to produce some kind of project within their community that's in line with behavioral health. And the point of it is to work with the mentor to have that kind of, security and to have those connections to make it a successful project. And we can talk more about what those projects look like. So that's a five-day meeting. And then between phase 2 and phase 3, our organization provides a number of webinars, and typically we leave it up to the participants at the time to decide what they're interested in. So for instance, one of the topics for this series will be managing up, like how do you promote a good relationship with your supervisor. It could also be public presenting skills. So we really just try to tailor it to the group that we have. We also offer monthly conference calls with all of the ATT staff who are involved with the Leadership Academy, all of the mentors, all of the mentees, and we really try to kind of keep tabs on how things are going, how are the mentor relationships progressing, how are the projects going, what kind of support can we offer. So we're really, really involved, and we really value the importance of both face-to-face and telehealth communications. Phase 3 is considered the enhancement phase. So really what we're trying to do is we're moving from classroom to the agency, I suppose. So at this stage, we invite our participants to, and we usually choose national locations, and we invite them to talk about the project they're working on and the progress that they've made so far. Some of our mentees maybe don't have public presenting skills, so this is an opportunity for them to engage in that process and just let us know where they're at with their project. During this time, in addition to the presentation of their projects, they also get to receive training from very specialized leaders within the behavioral health field already. So then again, between phase 3 and phase 4, we're continuing to offer webinars. We continue to have conference calls. Then we go to the recognition phase. So hopefully by phase 4, they have completed their projects, they have measurable outcomes, and they're able to share that in a presentation with everyone who's invited to attend. So it's a year-long process where it takes a lot of investment on mentors, mentees, and our staff's part. And I'll talk to you too a little bit about how you could apply for this if you were interested, or what our screening looks like. So we will have an application up on our website very soon, and it can be considered quite an extensive application. If you want to be a mentor, you could apply for that, or if you want to be a mentee, you could do that as well. So we have 2 separate applications. What we would need is a nomination from someone in management who could promote you and say that you would be a good fit for this program if you were a mentee. You would also have to address a statement of purpose explaining why you were interested, what your potential project would be, or what your interest would be. in addition to your past leadership experiences and what you think you'd get out of this. Is there anything else?
No, I think that's a good, yeah, I think that's a good summary
Yeah.
of the application process.
Yeah, and so it is quite selective. So we do take some time. We have a review committee to look over all of the applications that we receive, and we choose those that we feel would be most committed to the program and who could offer a good community engagement project. Yeah, is there any?
Yeah, I'll just add, so right now we are in the process of just beginning to get information out about applying for the 2015-2016 academic year. That information is going to be on our website. You'll see the URL for our website is up right now, and we will, as soon as we get the application ready, we'll have that information right on our homepage. And we are actually going to be accepting applications through May 1st. So there should be, you know, a good amount of time to work on that application and get it in by the 1st of May. And then we plan to have the committee review those and let people know if they have been accepted to the program by the beginning of June. With the program starting, the plan is for the program to begin in August. The immersion training is typically going to take place in August, and I believe the plan is to follow the same structure as it did this year, with having that 5-day immersion training taking place in Tama in Iowa, and then the other face-to-face meetings will take place in January in Miami, and then the graduation will take place in April or May in the Portland area. So yeah, the program is set to follow that same schedule.
Great. And I'm sure people are probably interested in knowing what the cost would be for participants. What we ask is that the people who are accepted pay a $500 one-time fee, and then we cover all of the travel, per diem, lodging. So all of that is pretty covered by our organization.
Mm-hmm. And typically, that's something that, you know, your agency may be able to cover for you if you're interested in this program, because it's a very you know, positive experience for them to have an employee go through this kind of training, and it's certainly worth looking into that as an option.
And it looks like we have a question here. What are some examples of past community engagement projects? That is a really great question. So given that this is the first year that we've facilitated this program, I can give you a few examples from our current mentees. One individual is trying to integrate behavioral health into primary care, and that within his organization, so that actually encompasses quite a bit of work. I know they're trying to hire, you know, someone within their behavioral health department, and then also someone within primary care, and kind of intertwine those two and move toward electronic records. So that's more of an extensive project. We have another mentee who is working with a tribal college, and they have spiritual services available, but they're not really sure if students are aware of, you know, what services are offered. So that individual is currently conducting a survey with students to find out what students would like, what they know about, and then they're going to issue a marketing campaign to get people more engaged in those services. Another individual is very interested in alcohol fetal spectrum disorder, and she is currently trying to decide if she develops an assessment to be used in primary care settings, or if she would like to just offer programming to various community organizations like social workers, or, you know, going into primary care and, you know, giving information about that. So those are three of the big projects that we have going on right now. Thank you for asking that question, and if you need more elaboration, I'm happy to provide.
Yeah, the individual community engagement projects, there's really a wide range of what you know, could be done with that. It's something that, you know, we want to be close to people's hearts and close to people's you know, particular experience. If you see a need in your current agency, or something that you think could be improved, you know, whether it's like a screening process, or there's a particular a particular drug that's like coming up a lot, and that people don't know, that might be a new, like, something we've been talking a lot about lately is the synthetic cannabinoid problem. Things that are kind of new that people don't have a lot of experience with, that could be a potential for researching. So those are always possibilities. Yeah. So, and yeah, please continue to submit questions about the program if you have those. We are going to take a couple of minutes now to show a really short video. This is just we at our last meeting, we asked a few questions of those who are currently going through the program, what their experience has been. And so this video just will give a little bit of an idea of what their experience has been. And I just want to say up front that I apologize for the audio quality. This is not a professionally done video, but I hope it is helpful to you. And also it might be small, but you can also make this full screen if you'd like to as it plays. I should say too that if you have trouble, if the broadcast isn't giving you a good view of the video, it is also available at the URL that is currently on the screen. So if you'd like to view it later, we'll also put that URL in our follow-up email. So if you have trouble viewing it now, it's something you could watch later too. But I'll go ahead and start that now, and we'll be back in just a couple minutes.
I think I've had both informal and formal leadership with regard to my leadership history. My preference actually has been to lead from behind, to sort of take a back seat and to look at everything that's happening and to kind of direct from behind. And then I've been in leadership positions where I've been in middle management and also as an executive director. But I really felt like I didn't have the skills and the knowledge that I needed to be successful. And so I think this program is something that helps to build those skills, and I think that's really important and will give me more confidence as I move into more leadership positions.
My project is on the fetal alcohol spectrum disorder and how it is underrepresented or identified, misdiagnosed, misunderstood, and it's still a growing concern that people don't know of it. So that's my goal, is to try to get more awareness out there, but also help providers make it easier to identify the spectrum disorder.
Well, I came in with high hopes to become a better leader, and with coming here, it has taught me that being a leader is a 24/7 job, and it pretty much follows that saying, practice what you preach. So I really enjoy the leadership styles that we have learned and hope to use them in a good way.
So far, I think the information about leadership styles has been really critical. Also, finding out what your strengths are and what the areas of growth are, I think has been really important. And that sort of has been the ongoing focus in my day-to-day work with the ATTC leadership.
Great. So I hope you were all able to view that video, and we, like I said, we will have more information available on our website soon, and the applications will be there. So if you are interested, we would love to hear from you. Mandy's email is also up here, as she's the main contact for the program. So if you have more questions about it, please feel free to get in touch. And so we do have some time, yeah, please continue to submit questions. But I wanted to ask Brent if we go back to that exercise that you had, I wonder if we could maybe read through this and then people could actually respond to the questions by typing into the Q&A pod, and maybe we could discuss people's responses as they came in. Would that work for you?
Yeah. Of course it would. You're going to have to advance my screen because for some reason my computer froze up. So if we want to go back to that and kind of look over that, it'd be awesome. If we have time, we could, and then they could maybe answer to you, whatever it works, whatever you want to do. Perfect.
Okay. Well, why don't I go ahead and just read through the scenario, and then I'll and then we'll go to the question page, and I'll read through those questions for people too, and then people could just submit their responses to the Q&A pod, and I'll make sure I'll try to read those out as they come in. So then Brent, you can maybe respond to what people write in. If that sounds good. So this scenario, Janice is in your group. She is maybe someone who is subordinate to you, and David is sometimes your lead person when you are gone. Janice just left your office and she was not happy at all. She had requested 5 days vacation time and you denied her request. It is the middle of the year ending and things are really hopping. 1 million reports have to be completed. You are scratching your head with these thoughts running through it. Janice knows better than to ask time off year end. She said David had told her it shouldn't be a problem, but they could cover her work. Because they could cover her work. David knows better than to tell an employee to plan on time off during year end without checking with you. So the first question is, how will this affect David's leadership of your people? So if people want to go ahead and type in your responses to that question in the Q&A, then we will, we'll have a discussion about it. I don't see any responses coming in yet, so maybe I'll read through a few other. Oh, we've got a couple. Okay, so Patricia says something went wrong in the communication process. Charlene says I would be less likely to have him in charge in my absence. And Patricia says David should have known. Why didn't he? So thanks for those comments. Brent, did you want to jump in? And
first of all, those are excellent questions or thoughts. And all of those is asking potentially David, sometimes is the leader, sometimes should have known better. You're right. Now the question of it is, go back to the question, how will this affect David's leadership of the people? Because David, in essence, gave her the permission to kind of go. So the question comes back to, and this is a thought-provoking question, is how do we handle that when your lead, somebody, if you're gone, vacation, sick leave, whatever, is doing that? Now, was he put in a predicament? We know that it's always easy to say yes. Where the difficult part comes in is when you say no, or maybe it's your call, being us, to do that. So in any question, maybe the pat answer at this point through these questions is, how will it? Well, first of all, let's answer the question, will it? And yes, it will. And it could deteriorate his ability to lead these people. So I love that one question is, what was he kind of thinking doing this anyway? And again, we can all fall guilty of this, that it was something that happened, shouldn't have happened, but it did. So I think the correct answer will come out of these as we go through these. So again, it will affect and it could deteriorate his ability to lead people. Okay.
Great. The next question, and there were some more great comments that came in after that, and I tried to respond so everyone could see all those comments, so please keep an eye and check those comments as they come in. So there's really good discussion happening. But we'll go to the next question. How will this affect the overall attitudes of all your people? So please go ahead and respond to that one now. Patricia says, a reset may be needed with more direction and communication from leadership. And Winifred says, this could affect staff morale. Charlene says, it could lower morale in me and those left in charge. Alshana says, diverse confidence in leadership style or communication between the leader and the people. Teresa says, lack of trust when decision is made may get changed. Anna says, trust will not be established in coming to the leader later. Looks like that's all we've got now. Did you want to respond to those, Brian?
Yeah. Well, first of all, you really start to think about it. So I guess, again, how, but and the answer is yes. How? All of you are right. There could be huge morale issues because she could go out and say, well, you know, David said this. David said I could go, and now you're telling me I can't go. And that person could go out through the workforce and say, you dirty person, David said yes, now. So, yes, it will have a huge morale issue because she will be that. She will be bad. She will be frustrated, all of that. So morale issue. And here's the issue to think about. People that have a morale issue, they like to spread that. They like to go to people and say, I was mistreated. I was wrongfully treated. Da, 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 da. So yes, you're correct. There could be and will be morale issues. I like the person that said leadership and the issue of trust. Excellent. It will affect both of those because not only will it affect David's leadership position, it will also have a huge impact on your leadership position. And so it will have an overwhelming effect on that. The second thing, trust issue, is that will we going to trust David? No. Are we going to trust you? No. So there's two major issues here that potential deterioration of trust has occurred. Excellent comment.
Great. The next question, which I think was somewhat addressed in that, is what are the long-term effects of this issue? And I'll go ahead and throw in the next question in too, so people can respond to both of these because they're somewhat related. It says, a people battle is about to begin, yes or no, and why? Okay. Charlene says it could, depends on how the issue is dealt with. Teresa says communication, barriers of judgment and action, listening barriers, and productivity. Anna says conflict will happen because it splits the staff. Okay. We'll watch for any others coming in, but did you want to respond to those, Brent?
Again, great comments. Is that whoever said the word conflict? It is so true, because this was between you as the supervisor, you as that leader, the servant leader, and you did not serve all the people, because the reason we go back is that the supervisor did not have a good, the leader did not have a good relationship and know David how he'll react. So that was a fault. Second is that conflicts grew other conflicts. So it's not the question of how you decide whether you can or cannot go. It's a question that the way it was handled give way to or nurtured or grew other conflicts. So without a doubt, this could grow even more conflicts and upheaval. And just remember, when she walked out of that office from that initial leader, and she was very upset, she's going to share that upset, share that conflict. And that conflict will breed, nurture other conflicts. So I love that. That was a great comment.
Great. Let's go to the next question. Does it matter what Janice wants the time off for? For example, tribal issues, to go to Las Vegas for a 5-day vacation, or to help her daughter with a newborn child? Please, again, submit your comments. Charlene says no. Roger says not now. Patricia says in the case of the newborn, I think so. And Teresa says yes. All right, so we have a little bit of a disagreement. Alshana says it does matter because it matters to the person requesting the time off. Anybody else want to submit their thoughts? Patricia said, oh, got one before that. Winifred says no if she has earned it, although not good timing. Patricia says FMLA laws could apply in the case of the newborn. Teresa says every situation is different. And Anna says tribal issues and daughter newborn child is considered part of medical leave laws. Okay, did you want to go and respond to that, Brad?
Okay. Again, everyone's starting to really apply. And so one thing, whoever said the Medical Leave Act, and that FMLA, which I'm very familiar with, and that is true, we're looking at a sickness. So it's a child or an illness that trumps about everything. You know, if at all possible, we need to let them go and be sick or have a child or help them. So if all possible, we would allow that. The second thing is, if in person is, you have to think about, does it matter that at this point we have all of these, remember, we have all these reports, we have all of this work to be done, and could that affect how we're viewed, we as the leader are going to be viewed? And yes, it will be. So again, I go back to the leadership, is that we, in order to, so it's kind of answered both ways. If it's illness, if it's medical leave, notice it's her daughter. And, you know, you're right, that does qualify for family home leave, family medical leave, FMLA, and or possible sick benefits. So you, depending on the tribe, depending on how administratively that's set up, that would qualify. I agree. So that's a great comment. Now, setting that aside, let's pretend that we're going to Vegas. Does that matter? Well, you got to remember, it's probably a vacation, well-deserved. Probably, if they found out that they're going to go to vacation, maybe we're envious that they're going. Who knows? But the problem, it's not so much what we're doing, because law requires us or prohibits us from asking, if you have vacation time, well, why are you going to take vacation? Well, that's the Privacy Act. You can't ask those questions. Do we want to know it? Of course we do. But the point is, if in the event it's not sick leave, it's not FMLA, then it is vacation time. So we have 100% right to either approve or disapprove in a leadership position. The question then lies, do we, can we, should we? And we're in a bit of a, because it's going to be a true reflection on you. It's a difficult situation, no question. So the question arises, does it matter? And it really doesn't. If they're going to take vacation time, they could take it just to stay home. So it doesn't matter so much that. The question of it is, yes or no, should we allow that person to go? And they're going to, we're in a tight situation right now. So probably at this point, you're going to have to assess, is there a way we can perform this work without her? If we can, obviously we'll approve. If we cannot perform this work without her, then we're going to have to keep her there. Now, is there a lot of bad scenarios there? Absolutely.
Great. Thank you, Brent. We just have a few minutes left, so as we go over this last question, I also want to encourage people to submit any other questions that you had for any part of the webinar today. If we can't get to all of them, we will certainly respond by email. I did want to say someone asked about requesting the applications and that the assessment is emailed to them. What I will try to do, I've been working on the updating the application, and I will try to have that ready to include in the follow-up email, which will go out to everyone tomorrow. And if not, we will be, I'll make sure to send it out to everyone who attended this webinar in the next week. That should be ready by that point. And as far as the strengths assessment, unfortunately, that's a piece that we do have to pay for. So it's something that we don't do until people have been accepted into the program. But yes, we will send out the applications to everyone who attended. So let's get to that other question, and people can submit your thoughts and then any other questions that you have. Well, first, Anna has a question. If the daughter is on her medical insurance for the minor, would this FMLA law apply? Brent, would you want to respond to that?
Read that again. I'm sorry. There was a beep on my phone. I'm so sorry. Could you read that? Repeat it.
Sure. It says if the daughter is on her medical insurance, maybe as a minor, would this FMLA law apply?
Yes.
Okay. Okay, so then why don't we have people respond to what are the possible concerns that could arise for David, Janice, and for other people? And then also, as I said, please submit any other questions now as we're getting ready to finish up, and we'll hopefully be able to respond to those. And Mandy actually has to head out for a class, so she's gonna take off now. But I just wanted to say thanks to her. And did you have anything else you wanted to say before you head out?
Yeah, maybe just something really quick. I think if there were like 4 takeaway points from our Leadership Academy, I would just like to let you know what we're promoting with it. Number 1, I think we're trying to promote culturally informed services, and that would happen by increasing the visibility of Native Americans in leadership positions. So we want to make sure that the services being provided to Natives are culturally informed and that, needs are being met. Another thing I didn't emphasize as much as I wanted to is that the mentorship model is really crucial. And so part of this is developing a global network, or at least a national network, to connect Native Americans from many different tribes and many different areas, and creating a small community. And lastly, we really just want to enhance the connection that people have with their tribal community. So, thank you for paying attention to our Leadership ME program, and I'm happy as one of the main contacts to answer any questions that you have moving forward. So please feel free. Thanks.
Great, thank you, Mandy. Yeah. And looks like we've got a few responses to the final question in our exercise. Teresa says, work stoppages due to all barriers coming up. The judgment of all, boundaries of leadership decisions should have been clear, or else you don't go on leave. After second-guessing decisions made by the leader, you left in charge during your leave, or trust his decision. Chelsea says it could create a hostile work environment. Many times, staff advocate for each other, and if someone feels that their colleague is being mistreated or treated unfairly, it may grow into a much larger issue for the group. Alshana says, history repeating itself, same type of scenario or situation, less or more group cohesion or leader and follower cohesion on the last question there. And Charlene says it would cause short-term bad feelings of anger, mistrust, and resentments depending on how the situation is approached. You can rely, hopefully, upon your past leadership. So thank you so much for those comments. And Brent, do you have a minute yet to respond to that?
I do, and you're correct. First of all, those comments are awesome. You're spot on. And better yet, how to close this out is, let me share with you, a good servant leader has vision. A servant leader thinks of things and possibilities. So in this case, you're right, we've kind of dug ourselves a hole, and it's difficult and awkward to get out of. So, first of all, to answer and kind of captive, number one, we should have thought this out before we got here. We should have had perhaps a meeting with David and said, David, now just to have a clarity here, when somebody asks you for leave, they, let me check with us being the leader, it would have solved a lot of problems. Second thing is that he could advise and said, please go check with us as the leader. I'm not sure, and we're a heavy workload. Could have helped us, again, beforehand. So, in other words, and we could have had a staff meeting or talked to everybody. Now remember, next month we're having really heavy workload, or 2 months. Say, tell your people, say, you know what? We're going to be under a tight restriction next month. We got to have everybody here. We got to do this. You got to motivate them to come to work. And that does not happen after you've booked a vacation to Vegas. So pre-planning, visionary is awesome. Now, in this case, there's no perfect way to get out of this. You should stand your ground and say, if you got to have the people there, again, we covered the sick. We'll rule that out. If it's vacation time, if you need them, they got to stay. If you possibly can work it out, let them go. But there'll be ramifications, because then they'll know if you cause problems, you get your way. It's not a good scenario. But the best part of this is we make mistakes as leaders. Only a poor leader allows that mistake to continue. So to answer this, and it's a short case study, is that we need to start leading people now. Whatever, and it's an awkward situation, I freely admit that. I know that's designed to do that. But great comments. I appreciate that. If you have further questions, we'll certainly address them and get back to you. Thank you very much.
Wonderful. Thanks so much. And thank you all for your participation. And for joining us today. I hope this has been helpful and a good learning experience. And just want to thank Brent again for bringing your experience as a leader and your knowledge. And yeah, again, I just want to encourage those of you to continue to develop your skills as leaders. And if you have any questions, please feel free to get in touch with us. As I close out here, I'll just remind you that you will be redirected to our survey. If for some reason that doesn't work out, the link to the survey will be included in tomorrow's follow-up email. And thanks again. I hope you all have a great day.